Hi, it's Shelly, and this is a different vibe today because so many of you, including my prior patients and of course my students and just general laypersons that know what I did for about 20 years. Some of you may not know, so let me just introduce myself. I'm Dr. Shelly of HETV YouTube channel, right? And I teach NCLEX and I work at the hospital, whatever. For about 20 years, I delivered babies as an OBGYN nurse midwife. And there is many people reaching out to me to please address this horrific case of a decapitated baby during delivery. So I have taken time out of my day to break it on down as to what is really going on with this case. Now, just a disclosure, I am telling you what has been reported. I have looked at least 40 videos and articles about what happened because I don't like to go off of one or two and then assume, and then there's rumors and just lies and misinformation. We already know about alternative facts. We learned about that during, well, we'll go on. So anyway, the bottom line is I did my best to provide the information that's been reported on the board. And then all I'm going to do, because hindsight is 2020, I wasn't in the delivery room. I can tell you that I've had, in all those years of practice, one shoulder dystocia case and absolutely wanted to basically die afterwards. During shoulder dystocia, it happens very quickly. Things take place in seconds. You are pulling and trying your best to get that baby out of there. There is a great risk for nerve damage and damage to the baby, to say the least. Decapitation is just kind of shocking. Never had anything like that or even heard of anything like that, so it is a very interesting case. But I did want to put that perspective out there. During the one time I had a shoulder dystocia, you don't know it till it happens. And to put the image out there, the baby's head is stuck on the outside of the vagina and the shoulders and the body is stuck on the inside, and you just have a few minutes to get that baby out, and everyone in the room is sweating, crying, perhaps freaking out, maybe internally. The nurses are doing their best to give suprapubic pressure. The doctor is doing their best to open up this patient's pelvis to get this kid out. But it is literally the baby's bone in the shoulder is up against the bone of the maternal pelvis, and bone against bone doesn't give. So ultimately you will end up doing a C-section if that baby doesn't come out. I was blessed. The baby came out. Big baby. Didn't anticipate it. Didn't have any warning. But this case is a little different and we're gonna go over it. So I broke it down into basically 4 or 5 different sections to both teach my students and to both teach the laypersons what happened here. And so I'm gonna use just like normal language like I always use, but a little bit of teaching in between. I hope you don't mind. So let's go over situation number 1. There is much attention being given to the delivery. And I hate that. I know it's shocking and that's the part that everybody's focused on. But to be really honest with you, there were red flags during the prenatal period that I personally, because I can only tell you what I personally would do, and I've been blessed. I've had overall really good outcomes. But I just want to tell you what I looked at, hindsight being 2020. The red flags that I saw with this case, I'll just give you the profile of this beautiful young lady, and then we'll talk about the things that I don't like, okay? Number 1, her profile during this pregnancy is that she's an African-American, gravida 1, para 0, which just means she's on her first baby. She's a 20-year-old in Atlanta, Georgia. She was diagnosed, and this is the red flag, she was diagnosed with diabetes 1 year ago. Now that's important because you're pregnant 9 months. In fact, she actually went into labor early. So that means, was she a type 1 diabetic or was she a type 2 diabetic because she was on the obese side? Or was she just Gestational, doubted, because the pregnancy again is 9 months. They said a year earlier, but again, we don't know. This is just what's being reported. Now I'm going to show you something that piqued my interest before I did any investigation at all. All I saw was what you saw, the picture of this beautiful, precious young lady. So here is this beautiful, precious young lady, and I'm showing you a couple of pictures because it should make you go, wow. Okay, so here's what I said and wow about. Here we go. If you look at this picture, and I'm sorry, this is as exciting as it gets on my phone, but if you look at this picture, this is the precious young lady who lost her son. And if you really look at the picture, you could honestly say, just looking at the picture of this precious young lady, she's really short. That does matter. She has a very short stature, and that plays a role in shoulder dystocia and big baby in the whole nine, right? Okay, dystocia, problems with the birth, short stature. She's really short. Now let me show you another picture. All of this is just, you know, on the internet for anybody to get, but I pay attention to things like this because, again, this is what I did for about 20 years. This is this precious young lady's picture, probably before she actually went into, and excuse me for my pop-up, before she went into labor, maybe. Again, I don't know, but I can tell you what I look at. She was huge. When I first saw her picture before any of my investigation, I said, whoa, that looks like a really big baby. I have yet to hear the size of this child, given that it's decapitated. Who knows how that, you know, worked out. So if we just consider short, obese, diagnosed with diabetes a year ago, reportedly, that is the biggest red flag that I see for why shoulder dystocia actually happened. A lot of complications that are killing women, especially Black and Hispanic women, are occurring because the red flags didn't go up in the pregnancy itself. Now, so we have an African-American, gravida 1, para 0, 20-year-old in Atlanta, Georgia, diagnosed with diabetes a year ago, pre-pregnancy from what I'm seeing. And she has a short stature. I definitely believe, don't know, that she was probably obese before she ever got pregnant. I don't know. She broke her water she came in for delivery at 37 weeks. And for her to be 37 weeks, she just looks big to me. And that's just my little gut opinion. I don't know anything about this precious young lady. Now, why do I have all these like profile demographics on the board? What do they mean? Well, Blue Cross Blue Shield did a study. In 2021, they pointed out that there is a 63% higher risk of perinatal morbidity, which means disease or injury, and mortality, which means death, to Black and Latino women compared to white. The risk is highest, here we go, because I said she was 20. The risk is even higher if you're 15 to 24 years old. And for context, the perinatal morbidity, disease and injury, mortality, death rate, these rates are highest in the South. And this young lady had her baby in the South. Now, she actually had her baby in Georgia, which doesn't have a bad mortality rate, but I'm just putting that out there because I'm teaching while I'm going over this. So that's the pregnancy red flag. What would I have done? She would have been referred to perinatal, high risk pregnancy management. I love you. I'll see you when the baby's born. You got to go to a perinatologist because I'm not feeling none of this. However, the obstetrician is a physician. And just so you're not out there spreading lies, and this woman is an African-American physician of 26 years in practice. So she's experienced. So perhaps she felt confident that she could manage this situation. That's fine. Just saying, I would have been like, bye-bye, Felicia. Go to perinatology for the management of this baby because of the diabetic status. Why am I saying that about the diabetic status? Here's why. You have up to 20 times higher mortality rate, up to 20 times higher risk of birth defects, perinatal death, and shoulder dystocia is 6 times higher with diabetes. In fact, I teach my students that diabetes is the #1 risk factor for horrible outcomes, whether they're in the belly, outside the belly, in the newborn, with the mother. It's a horrible risk factor. And we have had an increase in diabetes in pregnancy for obvious reasons. We also have an outrageous increase in obesity. You know that diabetes and obesity go hand in hand. They are together. Okay, that's the mother. Let's talk about the labor. The patient came in on July 9th, 2023. Her water broke first. She was only 37 weeks. Pitocin augmentation was needed. That is a little hint that maybe the labor was not, maybe her contractions weren't really there. I know with my precious daughter, her water broke first. It sucks really bad because then you're just like, well, where's the baby? Come on, contractions, let's go. So Pitocin was started. We know that there is a higher risk of complications with Pitocin. That's just a side note for my students. There's also a higher risk of C-section with Pitocin, but you know, students. The patient became 10 centimeters dilated after 10 hours of labor. Now, students, the average labor for your first baby is 24 hours, 18 to 24 hours. She did really well. So there was no hint during labor that this baby was outrageously huge. Although the short stature, the big belly, the diabetic status, diabetes makes babies really, really big because sugar crosses the placenta, insulin does not. So those things meant big baby, but to be honest, her labor progressed completely normal. 10 hours of labor, 10 centimeters, ready to push. She pushed for 2 hours, normal again. I don't know if she had an epidural. I have no idea. It didn't say. If you have an epidural, it can take longer to push. If you don't, you know, whatever. I don't know. All I know is what's reported, and she pushed for 2 hours, which was normal. She pooped out, she was tired, and she asked for a C-section. Now, most women want to be cut after pushing 2 hours, including yours truly. I ended up pushing a whole nother hour, had a baby that was only, I don't know, 6 pounds, so there you go. But I'm just putting that out there because we know that when you are in this situation, you know, your sun and your moon is showing, you're tired, you can't eat, you're exhausted. Cut me, get this over with, is probably more normal than not. Okay, just saying. Now, moving on. The delivery. The delivery, of course, we all know now, is where the shoulders were stuck. There was extensive tension, pulling, probably tugging, in all honesty, because I've been there, done that, t-shirt, sun visor with my one and only shoulder dystocia, which put the fear of God in me and made me want to retire and never deliver another baby. So it is that kind of situation, and it happens within seconds. So pulling and tugging, and here's where things get really crazy. Bones were broken in the face, the skull, the neck. Now, it is common, students, I'm talking to you right now, for the clavicle to fracture during a shoulder dystocia. But the whole bones in the face and the skull, nah, I ain't that girl. I ain't heard of that. I ain't seen that. I've been a nurse a long time. I've been a nurse in labor and delivery. I've been an OBGYN nurse midwife forever and ever. I ain't seen that. Y'all working with me on this? This is horrible. The baby more than likely, of course, died before they even went back for the C-section because the head was delivered in the vagina, through the vagina, and the baby's rest of the body was delivered through the C-section. Just freaking crazy. Now, when they went back for the C-section, this baby was born the next day, July 10th, a couple minutes after midnight. What makes this case extraordinarily cray-cray and worthy of some serious lawsuits, criminal investigation, is that reportedly, here's where everything went crazy. The mother was not allowed to hold her baby after birth. What the fuck, right? Like, seriously, that makes me lose my puppy. Because first of all, we know for proper grieving and for this family to kind of work through what's going on with this precious son that they just had, they should be able to hold their baby, and they're encouraged to hold their baby. And this happens for at least 24 to 36 hours. In fact, I just was in a meeting where one of our hospitals in the system I work for, they developed this butterfly suite, this beautifully decorated, cozy cuddle room for the family to be away from all the other families having live babies when they've lost their child, and they can have their child in the room with them for an unlimited amount of time so that they can just hold their precious baby. And that, believe it or not, is part of the grief process. This woman asked and was not allowed to hold her baby. Now, you know, nurses, that's some bullshit for real. So that is really worrisome, because I'm thinking, okay, nurses, you're going to get it for that one. That is not the standard of care. Okay, let's go on to the next part. This is the cover up, the alleged cover up. I mean, you know, I got all these parts and shit on the board, the pregnancy, the labor, the delivery. Here's the alleged cover up. The mother was told that Medicaid will not pay for an autopsy. Bullshit. If my baby is dying by unexpected causes, you better believe your autopsy is not something you're going to ever pay for. It is covered by the hospital because it's an unexpected death of a precious little boy, and you're not going to get a bill. So they told her she would have to pay for this. Oh my God. Just unethical, crazy stuff, and I ain't even surprised. Now, number 3, the death was never reported to the medical examiner. Okay, now, for real though, you ain't even told the county that this baby died unexpectedly. You know how they found out? The freaking funeral home. The funeral home had a little red flag when they got a baby without a head, and the head was separated from the body. Uh-oh, newsflash, this is crazy. So yeah, this is looking really bad, by the way. And then I don't even see no reason for them to go to court. We call this in my class a blank check. How many zeros do you want me to put on the check? Because you're about to get paid, and it don't make no difference because it ain't going to bring your baby back, and you're going to be traumatized for the rest of your freaking life. But this is a blank check. Now, number 4. Are you ready for this? This shit just gets so fucking crazy. The parents were encouraged to cremate their precious son. Now, I ain't got nothing to do with cremation. I ain't got nothing against cremation. You want to cremate me, throw me over some ocean or whatever you want to do, I'm probably cool with that. But why are they encouraging her to cremate her precious son? That is not a role that we play as nurses or doctors in the hospital. We don't decide how you want to bury your son. That is a personal family decision. This woman was encouraged to cremate her child. This shit is crazy. The parents, you ready? The parents were never notified of just how their baby died and under what circumstances, or that the head was separate from the body, until they found out from the funeral home. Let that sit there for a minute. Apparently, and again, I don't know, it's reported, okay? I pray that this shit is not right. I hope it's like some fallacy, some crazy stuff. But I mean, this is what's been reportedly, and this is what's really bad. The mother was told she couldn't hold her baby, and the baby was wrapped, shown to the family through the nursery glass window, with the baby's head propped up in a way that would make you or I or her or them think that her baby was intact. Yeah, that's fucking crazy. So let's just call it what it is. Shoulder dystocia is rare. When it happens, 99.99% of the time, it's with diabetic moms. because diabetic moms have extra sugar in their body. That's why your girl been low carb forever, but I'm just saying. Diabetic moms have extra sugar in their body, and that sugar crosses the placenta and the baby gets bigger and bigger, because just like sugar makes you fat, it makes your baby fat as well. And so the baby gets bigger and bigger. And the head, God is perfect, right? He made no mistakes. The head God created on all of us. This baby has a soft spot. So the head can kind of accommodate the pelvis. It can kind of squeeze on through there. That's why babies are born with cone heads, because they squeeze through the birth canal. But these bones right here, fat too, baby. But these bones, the bones do not fit through a pelvis when they're just too big. This happens in seconds. I have pulled and tugged and prayed and pulled and tugged and prayed and pulled and tugged and turned the mother over and tried to get the mother on her hands and knees. And I've had the nurse doing suprapubic pressure. I have sweated. I have cried. I have begged God to let this baby come out. And I never want to go through it again. Yeah, I'm glad I teach now, because that was really nerve-wracking. Shoulder dystocia does happen, and it does happen fast, and it does make you pull and tug and do a bunch of different things. And I have yet to see or even hear about a decapitated baby, but I absolutely know that damage occurs to this child as a result of all the tugging and the pulling. Like I said, fractured clavicles, nerve damage, the baby can't move their arm. All that stuff is real. It is. But to decapitate a baby with bones broken in the face, bones broken in the skull, bones broken in the neck is just, it's hard to put your arms around. And so I'm worried about all of this. And so I will follow this case. I hope this helped put perspective behind all of this. And deuces, because I'm tired and I'm out and I got to go home. And bye.